Yeah. All right. So, hello everyone. I'm Dr. Ketki Ravangave, developmental pediatrician from Pune. I welcome you all for today's webinar session, and it's my pleasure to introduce you all to Dr. Vishal Vaidya sir. He is a vice president of ECD Forum, that is Early Child Development Forum, and he's a senior consultant and he's a director of Milestone Child Development Center, Dwarka, Delhi. So today he's going to speak about school readiness. So welcome, Dr. Vishal sir. Over to you.
Thank you. Thank you, Dr. Ketaki and Dr. Anita, for this opportunity. So, today we will be discussing a topic which is very important for all the key stakeholders, whether it's parents, pediatrician, or educators. Starting of a school is supposed to be an important event in the life of parents, and it is a major transition for the child from a new environment, from a home environment to a new environment. So the parents they enjoy the participation of the child in the school, and the child has a new experience in a home environment from the home environment to the school. So if the experience is very good, then the child keeps on learning and has good abilities to develop with time. However, if the child does not have a good preparedness or school readiness, then his experience could be a little stressful, and it may be that he may not enjoy it and altogether can drift from the academics and rote learning. So, today we will be discussing about the school readiness. I hope my slides are visible.
Yes, sir.
Yes, sir.
Yes, sir.
So, why school readiness matters? There is a global concern regarding the school readiness because it has been seen that many children who enter grade 1, they are without the foundational skills which are required for their success in the school. And it can impact the literacy, numeracy, as well as the behavior of the child. And early childhood experiences, they shape lifelong learning, and it reduces the remedial burden in later schooling. And now the school readiness is becoming a global education priority. So uh, this is the result of a national survey of children's health data briefs 2022, in which the parents and caregivers were given a questionnaire comprising of 28 questions, on the basis of which they needed to evaluate the skills and keep them whether they are on track, whether they are emerging, or whether it needs support. And it was seen that about 9% of the children, which was equivalent to 1 million children, the overall they needed support for the school readiness, out of which the early learning skills and the self-regulation were the most affected. So, understanding school readiness, before we understand the school readiness, we need to see the foundation of learning. So, we have seen that, many of the children, when they go to the school, they are not prepared earlier, and their foundation skills for learning, like reading, writing, mathematics, are lacking. Now, it is seen that before the school admission, possibly these, changes occur, but the changes or the readiness for the school actually originates from the beginning when they are born. And the learning center of the human body is the brain. And it is said that when they have early experiences, they help in the activation of all these neurons, and they form new synaptic connections. And these synaptic connections will lead to their promotion of learning as well as memorization. So it is said, according to the Hebb theory, the neurons that fire together will wire together. So the early experiences that the child have, whether they are activities or tasks along with the parents or in any settings, will help them in the formation of their foundation of learning. So, what is school readiness? So, school readiness basically refers to the skills and the abilities that the child need in order to succeed and thrive in school and how a child learns. And there are domains of development which are involved, which has to be perfect before the child enters the school, which includes the physical milestones, which could be fine motor and gross motor, the language and speech milestones, that domain is also needed, and social emotional regulation, that domain is also needed for their success. And cognitive abilities or readiness to succeed in the school is one of the priorities. So, this concept of school readiness has evolved over time. It started with a maturational construct in which the maturity of the child was taken as a priority for the attainment of the skills which are needed for school readiness. But then this changed into a social construct in which it was seen that the focus shifted from the child to the community and the family services, which were required for the success in the school. And then the last, which is mostly now gained importance on the global level, is the interactional construct, which means that there is a possible child interaction with the environment, and that environment can include school, home, and all the key stakeholders which are involved in this, and interaction with them will help in the promotion of their learning part. So, what are the objectives of school readiness? So, the school readiness helps in the development of the social emotional part where they can self-regulate their behavior, where they can manage their emotions, and where they help to interact appropriately with the peer and adults. And they can build a foundational knowledge, including the early literacy skills as well as the numeracy, and definitely for the promotion of the overall health by enhancing their motor skills. The objective is also towards a positive attitude towards learning, which is by fostering the curiosity, persistence, and enthusiasm in the child, and the ability to communicate effectively, listen, and follow instructions. So, school readiness is basically defined in the UNICEF Charter as well to comprise of three ready ecosystem components, which are ready child, ready school, and ready families and communities. So the school readiness has a framework in which there are two characteristic features. It is defined by the development of two characteristic features, which is the transition from the home environment to the school and gaining competencies, and an interaction between the interlinked dimensions of school readiness, which is school, child, family, and community. And the activities in each dimension, they are simultaneous with the rest and they are not rigidly sequential. So we come to the developmental foundations. So what are the early predictors of school readiness? That is a ready child first. So child needs to be cognitively ready for the school success, and they should be knowing a child who knows numbers, colors, letters is supposed to be school ready. But the cognitive readiness also includes the logical mathematics, which is sorting and grouping, should be able to know the pre-number concepts and operations, spatial sense, pattern and measurements, and they should develop the skills of sequential thinking, reasoning, and problem solving. The early language skills should also be a part of the ready child, which includes the phonological awareness. The child should have the ear to the sounds, should be able to identify the rhymes, should be able to blend the sounds, and he should be able to recognize the rhymes and the sound units in the words. So these early literacy skills also includes the development of the vocabulary. In fact, the vocabulary is one of the robust early indicator for the success of the school readiness. Then they should able to know the print awareness as well. Print awareness is something like they should be able to recognize the sequential formation. For example, the right to left, going top to bottom, and should be able to communicate also and the print should have a meaning for them. So they should be able to recognize the corresponding text with which that sounds are aware. With this is helpful for the early reading part, and also the writing component is also needed for the same. So role of the other systems, that is Ready School. So school environment should be very encouraging, positive. It should be safe, secured for the child, and should help in the promotion of the learning. And it should also help in fostering and supporting a smooth transition of the child. He should be able to have access and opportunities to explore, to experiment, and the school should also be inclusive. It should be taking in those children as well who are developing at a different pace. Either they are slow learners or they have some special education needs as well. Along with the school environment, it's important that the school practices should include the trained and qualified teachers. The teachers should be trained enough to handle the kids in a social emotional way, and which should encourage their emotional well-being, and should also be trained in handling the special children as well. For that, different training programs are also taken, and if few of the teachers they undertake that program, then it would be quite useful for the children to adapt easily into the environment and lead to the success of his career, success in his career. So the high quality support service is also needed. The curriculum planning is also one of the important part, which is done by the teachers who are trained in accordance with the skills that is developed by the child, and which helps in the development of their not only physical but social emotional domains of development as well. Play-based curriculum is supposed to be an effective part which helps in the activation of many neurons at one time, and it helps in building the connections very fast, and the child is able to inculcate all the skills very easily and very fast when a curriculum which is based on play is used, which is enjoyable for the child. And this play based curriculum also helps in the promotion of learning as well as the memorization. Then we come on to the ready family and the community. The family environment should also be warm, caring for the child, affectionate, and there should be an interaction between the parents and the caregivers and the children in a positive way. So, out of these, we see that the maternal education is supposed to be one of the robust indicator for success. The maternal education helps in framing, a network in which the child actually gets that warmth and the interactive material also, which is responsible for his learning as well as acquiring the skills which are needed for his school readiness. And it has been seen the higher the maternal education, the positive results have been seen for the school readiness of the child. Now, certain parent beliefs also affects the school readiness part. Many of their beliefs are either positive or negative. If a parent believe that yes, the school enhances the abilities of his child, then probably the child will also inculcate the same habits from the parents. But if the parent has experienced a tough life during the time of his school, has not been benefited much from it, then probably this pass on to the children and they develop a fear of going to the school, and thereby they lack the development of learning phase in their school, which is required as a scaffolding for their later success. And the parents attitude and expectations also affects the readiness of the child for the school. And sometimes we see that the family structure, whether it is a single family or an extended family, also has a positive or the negative role. For example, we have seen that if many studies have shown that if the child parents, mother and father both are living happily together, then it has a very positive impact on the child. And even if the child has only one parent, either because they are single or they are divorced or there has been a death, then the interaction and the relationship of the child with that parent if it is in a positive way, then also it enhances the child's ability to adapt to the school, and it promotes the learning part as well. And there are varied socio-cultural practices which also affects the readiness of the child to the school. And the community should be able to give the access to the health services to the child, and if the provision of quality early education is there, and if the nutrition support is given, and the collaboration with the partners like NGOs to support the families who are having the barriers like socioeconomic status, financial limitations, poverty, discrimination. So these things also can help as an early predictor of the success of the school readiness for the child. So, coming from the neurodevelopmental perspective, the neurodevelopmental conditions which include but are not limited to hearing impairment or vision loss, epilepsy, intellectual disability, cerebral palsy, autism spectrum disorder, attention deficit disorder, speech and communication problems. So, all these affect the school readiness, and it has become a critical component now of the global health agenda for children under 5 years with disabilities. And this has also been reinforced by the 2015 Incheon Declaration and Framework for the Action for the Implementation of SDG 4, which is led by UNESCO. And it is also consistent now with the United Nations Conventions on the Rights of the Child and the United Nations Convention on the Right of the Persons with Disabilities. So, but there are a lot of challenges that these neurodevelopmentally challenged kids faced, and there are many reasons to it. If we see there is a lack of access to the timely detection and intervention services, perhaps this is the greatest barrier. If they are timely detected and the early intervention is started, probably they can be, they can be uh, encouraged to get more of the abilities to develop with time under the supervision for the school readiness part. And a lack of routine newborn screening and development monitoring is also one of the components which is lacking. It's mostly concentrated in the urban areas, and in the rural areas still there is not enough infrastructure and protocols for routine newborn screening, and thereby many of the children would be missed if the newborn screening is not there for any hearing impairment or for any vision loss, or in fact if there has been evidence of any cerebral palsy cases and all. And development monitoring is also not possible in many of the cases because of the lack of healthcare facilities in that areas or the healthcare personals in that area. And there are unique challenges also which are related to the specific disabilities. If we see a child with an autism spectrum disorder, so they have unique challenges. Sometimes they're not able to communicate well, and they have some externalizing signs as well and behavior regulation problems, which does not help them adapt to the classroom. And there are certain sensory issues with them which cannot help them adapt to the peer groups, adult groups, as well as the school environment. And sometimes a child who's having ADHD is not able to socialize with the other kids, and therefore they land up into many learning disabilities or the social problems and all. And these unique challenges have to be addressed before we
మళ్ళీ
make
కాలేజ్
the
లేదు కదండి.
school readiness. So at the level of the school, there is
సార్
discouragement
మళ్ళీ
in
కాలేజీలో వద్దునంటే ఆ టాబ్లెట్ ఏంటి అయ్యిద్దంటే మోషన్ పోయే టాబ్లెట్ ఏంటి అయ్యి.
Ketki, please mute everyone.
Anita ma'am,
Yeah, I'm doing it. I have muted.
thank you.
Dr. Vishal, you have to unmute yourself. I have muted all. Dr. Vishal, Dr. Vishal,
Yeah.
sir.
Yeah, I've done it. Thank you. At the school level, there is a lot of discouragement due to discrimination, due to prejudice and non-acceptance from the peers. The peers are not able to know the condition of the child, and they have no knowledge about what the child is suffering from, and even the Teachers also sometimes are not able, if they're not trained enough, they're not able to know that the child has these type of problems and how to handle them. And the lack of poor quality learning opportunities and proper guidelines for implementing the inclusive education in schools is also a challenge. uh, there has to be an adequate knowledge about the disabilities and inclusive education, for which hands-on training and workshops should be conducted for the teachers, as this is the biggest challenge which is faced in the school. And in fact, lack of infrastructure facilities for the child with disabilities is also one of the factors and challenges which are faced, which is not there in every school. At the family or the community level, there are personal challenges. The parental perception regarding the child, whether their child will be benefiting from the school readiness as he is a disabled child or a child with special needs, and their concerns whether he will success or not, also poses a bigger challenge at the family level. And the societal challenges are also there. Sometimes there are financial limitations, there's poverty, discrimination, resources in the school and travel are deficient. Programs and services are also costly. They are not inclusive and mostly concentrated in the urban areas. There is lack of knowledgeable and skilled service providers. And the basic thing is that these children with neurodevelopmental problems, they also lack essential vaccinations because of the perception whether the parents are also not aware of this, that they need to get these essential vaccinations as well, and the basic treatment for the childhood illnesses. And these hampers their school readiness part a lot. So these are the red flags which should be always seen before the school entry. If the child cannot follow a two-step commands, if the speech is largely unintelligible after 4 years, if the child cannot sit even for 5 to 7 minutes, if there is a poor peer interaction, if the child is not toilet trained by 4 to 5 years, then possibly it is better to refer to a developmental pediatrician for the assessment or for to the therapist for the therapies. Then approach to school readiness. There needs to be an appropriate assessment of the child, which is an important signpost to assess the magnitude of the school readiness, which can be done at the program or the individual level. It serves the dual purpose. One, we need to recognize whether the child is having that type of skills and abilities to adhere to the school readiness. And the second purpose is to see whether the implementation of these programs, what is the outcome of it. So these assessments establish a baseline and document the magnitude of the problem, and it understands and supports the children's development. It also assesses the intervention or the programs. It also documents and evaluate the program effectiveness. So how do we do the assessment for these children? There are two methods for it. There are standardized, assessment tools or norm reference assessment, which is a formal assessment of the child, and there are naturalistic or informal type of assessment in which the child is observed for structured activities and structured observations. His portfolio individual analysis is done with the help of interaction with the parents as well as the other teachers, and there is a parent and teacher rating of the child behavior as well, which can help in the informal assessment. And assessment can be done by using multiple assessment approaches and tools and information from multiple resources. So these are the formal assessment tools which have been used in order to judge for the school readiness and the child readiness. But most of these assessment tools are from the Western side, and the problem is that their reliability and validity in the Indian context, plus they are not available in the vernacular languages which is needed. If we see the early development instrument, which is developed in Canada, is highly successful assessment tool for the child readiness school health facilities there. But this cannot be extrapolated or reliably validated here in India. So we have one nursery evaluation scale, Trivandrum, which is abridged, which has been developed in India under the supervision of Dr. M.K.C. Nair from the CDC Trivandrum. And this is a very simple tool, which can be applied very easily by any community health worker. It takes a very less amount of time, cost effective, And it has been applied even by the community health worker, and they have been able to know the readiness of the school. And from this nest tool, and in fact, this is an abridged form. There is a full version of the nest also, which has been published in IAP, which is also helpful in the assessment of the child for the readiness. Regarding the school readiness, the tools are available, but they are not that reliable or validated. So we need to ensure that the quality of pre-primary education is mandatory in all the formal schools under all the sectors, whether it is government, whether it is private. And pre-primary exposure of the child is very important, as during this time the child develops his pre-learning skills as well, like pre-writing skills, pre-numeracy, and pre-reading skills. And for this to be quite effective, we need to have a responsive, affectionate, and readily available adult-child interaction. There should be trained teachers and staff members. There should be appropriate adult children ratio in small class size. Too many children in a very small class will not serve the purpose. And the curriculum should be according to their developmental age, and they should have a good positive learning experiences, building on their prior experiences as well, the early experiences that they had. Providing the classroom equipment and materials to support children active and thoughtful engagement also promotes learning. And the trainings for the pre-primary teachers through regular refresher and orientation programs is also a part of the quality pre-primary education. Now, early intervention, yes, early intervention can have a strong influence on the readiness, enrollment, progress, and learning in the primary schools, especially for those who are underserved and children with neurodevelopmental disorders. And it has been seen that the early intervention should be somewhat which is carefully designed, should be child focused, should be directed towards the children and family interaction. It should be low cost, it should be pedagogically effective, and it should be culturally appropriate and acceptable. And these interventions have been seen in quite of a lot of data from the several developing countries, shows there is a strong association of the early intervention developing the skills and high school completion. So this early intervention ensures to make the children ready for the schools. Now the childrens are diverse because there are early life experiences which could be quite diverse. There could be a wide variation in the young child development. There could be a difference in the learning part because of the socio-economic status of the child, and also what is the child care history, how he has been taken care of, what childhood illnesses he has suffered, is there any other emotional or social problems that have been occurring in family. They are all significantly related to their readiness to learn. And the risk factors like poverty, parental level of education, high level of smoking in a parent, depression in a parent, and lower parenting skills, where they do not know even that the parenting skills are required to make a scaffolding for learning in the further years of a child, is also to be addressed for the good outcome for the school readiness for the child. Now, the developmental goals. So, there are three developmental goals which are required for the child to be successful for the school readiness. One is that the focus should be on the good health and well-being of the child to provide them the experiences for physical and motor development and social emotional development, nutrition, safety, hygiene, and sanitation. So you can see that the outdoor activities and the balancing activity in between also helps in the concentration of the child. And the outdoor activities also promote the healthy well-being, and they develop a thinking for the child for an energetic lifestyle in the future. And the counting sequences are also helping in developing their motor skills. Then the goal two is the child should become effective communicators so that they can build the foundation for language and literacy. That could be through the role plays, that could be the use of mask in the role play, and that could be through the poems and actions. And the third goal is that the children should become involved learners and connect with their immediate environment. and to build the foundations for the numeracy, reading, writing, providing them direct experience and interaction with the physical, social, and natural environment. In these, as you can see, the leaf game extracts, the puppet makings, then learning the single digit sequences through the games, then fun with the colors and with the numbers, they all promote the learning of the child in terms of numeracy and in forming a fun filled, joyful class. So this is a pedagogy that should be followed, in which play assumes an important part, as play curriculum based children show a high level of readiness of school easily, and they develop good cognitive as well as executive functions through them. And the interaction of the child with the adults, the children, the peer groups, the teachers at the school also helps them making them an engaged learners. And a positive environment, whether it is at home or whether it is at the school level, and the interaction of the child with the positive environments also helps them becoming active and helps their promotion of the learning part. So what is the role of the key stakeholders? So the key stakeholders, among them, the central part is the pediatrician. So the pediatrician has a very important role in guiding the health as well as the development of the child, which can be through preventive healthcare. There are regular well child visits which happen. There is a growth monitoring which can be done to the immunization, and during the time of immunization also, this development screening for the identification of any red flags can be seen. And in case these red flags are seen, then timely referral for the early intervention is also one of the part of the pediatrician. And he also supervises the mental and social health of the child by interacting with the parents and examining the child and just interacting with the child to know how he is behaving. The education of the parents with regard to nutrition, safety, and positive parenting strategies add to the positive aspect of school readiness through the caregiver, and the comprehensive care given by the pediatrician in diagnosing and treating the injuries, infections, and chronic conditions, and referral wherever required to the specialist also promotes the health in the all the domains of the development, and it promotes the school readiness part of the child. Parental involvement, parents are the great teachers. They are the first teachers, and their involvement and support is essential. So they should create a positive learning environment at home. They should engage in learning activities together. They should also help in the child developing his self-independence and his executive problem-solving skills. Should also support their social and emotional development. And everything which is, whether it is a big or a small achievement, they should be celebrating with the child and encouraging him in all his ventures. They should also be guiding him what is right and what is wrong. They should also balance support and independence. And of course, their interaction with the school teachers and staff also helps in monitoring their capabilities and monitoring their progress in the school. Then educators, yes, they are the mainstream in the schools. They are the ones who basically build a scaffold for the success of the child in the school, and they should be able to recognize and manage the needs, whether it's a child with special needs or whether it's a normal child. What are they needing? They should be knowing about it. They should be a cooperative learning. They should be enhancing a social inclusion, offering all of them equal opportunities. And they should also tell them about the mutual respect among the peers as well as the teachers, and how to adjust the assessments and assignments. What are the parental concerns? They are need to be addressed by the educators, the teachers. Then they should also develop a curriculum which can be adapted according to the diverse needs, and there has to be a collaborative approach. And establishing a good learning environment always helps in the promotion of learning and success for the child. So the key takeaways uh, are that the school readiness is not about only early academics. It is about the holistic developmental preparedness. The strongest predictors of the school success are executive function, language, and social emotional regulation. School readiness requires the interlinked dimensions, their alignment, the child, school, and the family. And early identification and the intervention during the preschool years can significantly alter the developmental trajectories, especially in children with neurodevelopmental disorders. And implementing the play based, developmentally appropriate learning is essential to prepare the children for lifelong learning. Thank you so much.
Thank you so much, sir, for such an informative lecture. Anyone wants to ask any questions? So there's one question in the inbox by Dr. Tahera. I hope I'm pronouncing it right. Sir, any information, sources, or book or application that can be recommended to parents so that they can track the development of their child and pick up any delay in milestone, as they are the primary caregivers?
Yes, there are a lot of books, there are a lot of apps which are available on the site on the internet, which there is a milestone tracker. There is a site by the CDC, which essentially gives the milestones which are achieved at different ages of the child. That can be referred. There are certain books also which are there available on the school readiness programs as well, and mostly the parents can easily track the milestones of the child through that application. But I would recommend the standardized one is the CDC app, the for the which
Central
has been given by
Disease
the
Control.
Central Disease
CDC
Control.
is different when the
Yes.
Central Disease Control. Yeah.
Yeah, we have one mother and child protection card also. That is also quite good, and it's available in all the regional languages also. That's a simple one in the regional languages. I think you remember that it has the three parts to it: a green part, a blue part, and the red part. Green part gives us the developmental milestones in that age range, and blue part gives the parental early stimulation activities, and the red part gives you the red flag signs related to that age. That's also quite good. And that is in the hand of every pregnant lady who goes to the government setup. They're given this booklet.
That is easily available also.
Yeah.
So, sir, I did one. It was my thesis topic about the school readiness. That was in 2022 and 23. So I did the study on around 100 students, and I chose formal educational, already those who are in the first standard. So these were the children who were suffered due to the COVID period. So they didn't have any exposure of preschool, preparation, I would say. So to my surprise, my findings were these children were good with gross motor, adaptive skill, but they didn't have any numerical sense, or you, as you said, the pre-literacy things.
Cognitive
No
readiness
citing
might
of
have been.
words. Absolutely. In fact, fine motor were also delayed. So holding a pen or cutting it on the paper. So it was shocking, and they were already in the first standard. So that was
This might have been because of the lack of the preschools and the lack of
absolutely.
the interaction of the parents with the sometimes the parents are also not educated enough to know what all activities that have to be taken to make them capable of the preschool education and the school readiness purpose. And during the COVID time, though, everybody was just on the screen most of the times and were not interacting as well. So that could
Yeah.
have been one of the cause. But now a lot of awareness is being,
Yeah.
it is there in the parents and it is
I
being
do get a
spread.
lot of patients. Basically, it is from the school, where the school feels that if they see any red flag sign, they want proper evaluation done, and then they go for the admissions. So that is something happening in Pune, at least.
Yeah, actually, hello everyone. Congratulations, sir, for a wonderful presentation. I am Dr. Madhavi. I'm a development pediatrician from Hyderabad. So, regarding this topic, I just wanted to say that as a group of development pediatricians, I think we all should bring about a policy or an advocacy where every school should be associated with one development pediatrician, so that whenever they detect these sort of things, the child should definitely, and every child of a preschool should be evaluated by a development pediatrician, guide the teacher and the parents accordingly based on the level of the child. So that will actually be a collaborative effort by the development pediatricians, parents, and teachers. And the burden would be equally distributed, and definitely we can do far better in guiding them.
You're absolutely right, ma'am. In fact, we actually tried to collaborate with, many of the preschools. So we just wanted to get, associated with them so that, we can just monitor the progress of the children as well. And we told that we can, just train the teachers also regarding that. But I don't know why there was no positive response from their side. We pursued so many times, but then
At
what
the most, I
thinking they
feel
have in
as
mind, we don't know.
Vishal, there are some good questions from parents. I think
yeah,
we should address that. There's a age bar, something like this. Is a wonderful presentation,
yeah,
Dr.
yeah.
Vishal. So
Thank you,
many
ma'am.
more to come from you.
So there's a question from Kinjal Shah, and she wants to know, hello, I'm a parent, a small doubt. When we say school readiness, does it mean class one or primary school? Uh,
Absolutely.
that's
School
very common
readiness
question to address.
means, yeah, school readiness means it's a primary school from grade one. But actually, the basis of that is formed from the preschool experiences. So the primary one comes from the class one, grade one.
Yeah. So there's another question by Dr. Anju. What should be the ideal age for assessment for school readiness before entry to nursery, that is 3 years of age, or class one, 6 years of age? I think, as you
The
just now said, it's the same
the
answer.
ideal age is from 4 to 6 years that the child should be assessed. Though the development monitoring will keep on going with the help of the pediatrician who should monitoring, but ideally, from 4 to 6 years only is the ideal age where that should be done. And we have a very good tool for this, which is Nest abridged or Nest full version, which is reliable also, and it is validated also.
Yeah, and it
And
covers all
all the
domains:
aspects, gross
gross
motor
motor, fine
aspects,
motor, social
cognitive,
language, socio-emotional,
absolutely all the domains of the
cognitive, and adaptive skills also. And it gives a baseline to do the intervention also. So that's, and it has two
One thing I
levels.
would like to just highlight, Dr. Vishal, can you comment on this thing, this trend going on? People are choosing homeschooling nowadays. So, what do you think about it? For primitive years, there are many people on social media. You will see people are choosing for homeschooling. So,
Yes,
what's your take
we
on
we
this?
we we have seen many of the parents when we have told them to, whether you have admitted them into a preschool and also they have been told, he's quite, intelligent enough, so I have been guiding him at home only. तो घर पे हमारे बच्चे को सब पता है सर, मैंने उसको सब सिखा दिया है. But there are certain things for which, the preschool teachers are trained for and they know. And the best thing is, the social and the emotional regulation, the cognitive readiness. Academics के अंदर सिर्फ, telling them about the colors, shapes, and, letters is not enough. They usually gauge it through that, angle only. कि जो हम physical gross motor तो इसका बिल्कुल ठीक है. We have just, told him about the academic part. He knows about the body parts, color, shapes, and all that stuff, and he's ready for it. But what about the social and emotional regulation part? So that will only come when he gets interacted with the children of his own age group, the peer groups, as well as the teachers in the school. In new environment, adaptability to a new environment is also needed, because sudden transition from, the home to the formal school will be a big problem for the child. Can be a big problem. I'm
Yes,
not saying that it is in all the children, but it can be. But if,
definitely.
they are admitted into a preschool, then probably they get to know many things. Their behavior
So,
pattern shall
is
change.
it preschool? You mean playway, or is just preschool means just primary school basically, not always
No, no, not the
preschool?
primary. The preschools, the play schools.
Okay.
The play is a curriculum. Play is a curriculum in that.
Okay.
We say at play school, but
Okay.
it's a preschool.
Okay. Okay. Right.
So here, what
Thank you,
you
Dr. Vishal.
explained in between was the ecosystem that plays a major role when to answer this question. The community,
The
family,
family, the
and
community, they should have that,
child
commitment
readiness.
also to do it.
That ecosystem, yeah.
This is what Dr. Madhavi also told that, there has to be an association of all the, phases, which are all the key stakeholders which are involved in it, along with the policy and implementation. She's absolutely right with that. But that will take a lot of time because right now also we do not have enough, school readiness program also. There is a program which is called as Nipun, which is, National Initiative of Proficiency of Understanding and, Reading. And this has been started under the NEP 2020. And it has been through a play-based curriculum which has been done. And in this, the from the Bal Vatika to the grade 2, these all children have been taken. And this has been going on for quite a long, since 2022, under the National Curriculum Framework for the foundation stage. So they have started it, and definitely they have made it quite, attractive for the child. In fact, the developmental goals that I showed you were from the Nipun Bharat only. But the only problem with that they were lacking a standardized assessment tool for the child. So that is not there. So that was the only drawback. Other institutions like CRI and all, they have also developed some school readiness program. There is one which is, Vidya Pravesh also, but they have not been, promoted in the way that they should be because of, the resources, or because of, the commitment to the policy implementation. So these are all certain factors which have to be taken into account.
So there's one more question. How do professional measure progress in early intervention?
So, see, that can be through formal assessments also. Okay, if we are talking about the those who are neurodevelopmentally challenged, okay, so in that cases, like in autism or ADHD, there are certain tools which are available. So which we can, for example, if it's an autism thing, and if we do a assessment tool like ESA or CARS, then the progress can be assessed after 3 to 6 months with those tools, and we can do that. Or otherwise also, if we are doing it informally, then probably we can observe the child and see him involved in the activities and how far he has been able to attain those things in comparison to when he had been there before the early intervention part. And it has been seen that early intervention, if it is properly designed and child focused, and appropriate time is being given at the center as well as the home, they will come with flying colors that they will improve like anything.
So I think simple developmental screening test, if not any
Yeah,
neurodiversity
that depends because
claim,
actually,
that can also helpful.
yes, absolutely. So
That
there is a
is
DDST2 also which can be seen if there's a developmental delay. So it pertains to, early intervention in which phase, for what
Which
specific disability, or disorder it is being asked.
And if they are having a developmental assessment right from the infancy, that would work out better. In early screening, and early intervention. You don't have to bother it at a later age. Right. So, shall we conclude? All the doubts have been cleared, and before we disconnect, I have a big announcement to make. So we are conducting an ECD conference, ECD Early Child Development Conference in Hyderabad on 21st and 22nd November. And I invite you all to Hyderabad. You'll have a splendid experience in the academics, in hospitality, and of course, our favorite foods. Don't miss this opportunity. We'll be there to welcome you all. All of you, please register for this. We have an early bird registration fee of 3,000 rupees. The MCI points will be available. So please register at the earliest. We'll have plenty of hands-on workshops where we are going to not just the theory, the practical hands-on workshops regarding early child development, and lots of interesting scientific programs are lined up. So don't miss it. It's just for 2 days, 21st and 22nd November at Hyderabad. We'll announce the venue at a later date.
And
And
this
it's for
conference
everyone, parents,
for
teacher, therapist,
Yes.
doctors,
Not just
pediatrician.
doctors, everyone can enroll. Whoever is there in the field of child development, who are all the stakeholders of early child development, like the teachers, the RCI professionals, special educators, psychologists, therapists, parents, not every parent is eligible, and the parents of neurodiverse kids are. We'll have a blast there. You have lots of information for you. We have lots of hands-on workshop and sessions lined up for you. You'll gain lot knowledge how to handle your child and all. So don't miss this opportunity. Do register, and the early bird at the early bird fees, you'll have a lot of discount on this. So don't miss this opportunity. Early bird is up to 31st May. So don't miss this window.
Yeah, and we all wait to see all of you at Hyderabad. Definitely. Yeah,
Yeah,
I am the
thanks so
treasurer
much.
too.
Dr. Madhvi is the treasurer,
Madhvi ma'am.
and myself,
Yes.
Dr. Anita, I'm the organizing secretary, and our organizing chairperson is Dr. Sri Krishna. He's not here today, but we all welcome you to have a wonderful scientific and visual and gastronomic experience at Hyderabad.
Yeah,
Sure,
Dr.
thanks a lot.
Anita is doing her best efforts to bring up all our flyers very soon on time and has been coordinating a lot. So we all enjoy working with her together.
Mhm. Good to know. So Hyderabad, we are coming.
Yes, registration is open, Dr. Pratyusha. Before I conclude, today I was just watching TV and came across one ad on Parle-G. I just wanted to share you. Second.
Could I stop sharing my screen?
Yeah, please. So this is a beautiful video, a small video. Of course, we are not promoting biscuits, but can you see? Wait, just- can you see my screen?
Yes.
Yeah.
This is, it's the audio files. Yeah.
అమ్మా
It is in
ఉగాది
Telugu.
రోజు మన యుగ ఎందుకు
This is
డల్ గా
in
ఉంది? మన లిటిల్ ఛాంపు క్రికెట్ టీమ్ లో సెలెక్ట్ అవ్వలేదు కదా,
So she's saying
అది
that
సంగతి.
that little girl is not selected in the cricket team. It's in Telugu, so I'm translating it a bit. So this is on the line of Ugadi, our festival, Telugu New Year. This
వాళ్ళు
little kid is
నాకు
not
sad గా
selected for a
చేస్తారు.
cricket team.
నిన్ను క్లాస్ క్రికెటర్ గా చేసినప్పుడు నువ్వు చాలా హ్యాపీ కదా? ఆ, అవును హ్యాపీయే కదా. మరి పరేడ్ లో నిన్ను ఫ్లాగ్ బ్యారర్ గా చేసినప్పుడు ఏమీ కంప్లైంట్ చేయలేదే? అక్క, దానికి ఎవరైనా కంప్లైంట్ చేస్తారా? యాన్యువల్ డే డ్రామాలో మెయిన్ క్యారెక్టర్ దొరికినప్పుడు బోరెడు గంతులేసావు. అక్క, ఏమైంది నీకు? వేరే పని లేదా ఏంటి? అమ్మ నిన్ను బెల్లం అయిపోతుందని చెప్పింది కదా, వెళ్ళక్క. నా బాల్ ఇచ్చే. అదేగా బెల్లం వేపు తెచ్చావా? కొత్త బెల్లం తెచ్చావా? వేపాడేది? వేపు లేకుండా ఉగాది పచ్చడి ఎలా చేస్తాం? నేను చెప్పాను కదమ్మా, అక్కకేదో అయింది. అంటే బెల్లంతో పాటు వేపు కూడా కావాలి. అవును, అయితే ఈ ఉగాదికి మనం తీపితో పాటు చేదు కూడా తినాలి. అంటే నాకు అర్థం అవ్వలేదు. అదే మన లైఫ్ కూడా, తీపి చేదు అన్నీ ఉంటాయి. ఉగాది కూడా మనకు అదే నేర్పిస్తుంది తెలుసా? అందుకే బెల్లం వేపు కలిపి తింటారు. ఇవన్నీ మర్చిపోకూడదు, అర్థమైందా? నా మంచి యుగ యుగ ఉగాది.
I think many of you must not have understood this. So Ugadi is a festival of Telugu New Year where we have all the flavors mixed. We make one Ugadi Pachadi where we have all the 6 flavors. Like along with the sweetness of the good, we have this neem flowers also. Neem flowers are bitter, right? So the girl, when she was not selected for the cricket team, she was really upset. So her sister is reminding her, you got to be the monitor, and some one of your the science project was selected. You were happy at that time. So she was reminding that along with that sweetness goes the little bit of bitterness also. So you have to accept a little failures here and there. So that is simply teaching her resilience. So that is also one part of being in a school where kids learn resilience, isn't it?
Yeah. Beautiful way to put it.
Yeah. Well, that doesn't happen at homeschooling, right?
Yeah, about
True, true.
homeschooling. We don't learn, in homeschooling, we don't learn sharing, turn takings, or sharing our, ups and downs with our peer group. So that is something that which parents cannot teach, that the child can learn only from a peer group interaction, which can happen at school, and also listening to the teacher, whether she likes it or not, obeying orders, following instructions. All these things come from schooling. So, schooling is a very important part of socio-emotional learning, which, if not developed properly, will later in life lead to behavioral disorders. So, it's very important that school has a big role in our neurodevelopment progress.
True.
Done. Thank you, Dr. Vishal, for the wonderful session. We are
Thank
looking
you.
forward for more and more sessions from ACD Forum. So we'll meet up next month again.
Yeah,
Yes.
thank you, Vishal. That was very good. Thank you, Anita, for your wonderful video.
Thank you, Vishal sir. Thank you, Anita ma'am. See you again. Bye bye.
Thank you,
Good
Dr.
night.
Anita.
Thank
Bye.
you, everyone. Good night.
Good night, everyone. Bye bye.
Good night.